This is a surgeon, specializes in neuropathy surgery. And he says that the nerve is surrounded by fat and inflamed. This is good news for me. All I got to do is instruct the HDL and LDL to go over there, remove the fat. Hopefully the neuropathy goes away. Simple as that. So I'll play some of his stuff.
What that first layer of the cake is. The second layer of the cake is there because what happens to nerves, and again, so maybe let me back up for a second. If those of you who are old enough will remember those Coke Pepsi challenges where somebody would take a drink of the Coke and somebody would take a drink of the Pepsi and be blinded and they wouldn't know which one is which. As a surgeon, when you operate on somebody who has peripheral neuropathy, it doesn't matter if they have diabetes in their medical history or hypothyroidism or no known risk factor. The nerves look identical. They're all swollen. They're all infiltrated with fatty tissue and surrounded with fatty tissue. And so whether you can identify the first layer of the cake or not is not that important. What's crucial in terms of whether a patient is a candidate for surgery to try and relieve the symptoms of their peripheral neuropathy is, do they demonstrate evidence of mechanical nerve compression when you examine them physically? And when I say mechanical nerve compression, terms like pinched nerves or entrapped nerves, that all means the same. It means that the tissue around the nerve is putting pressure on the nerve. Now, this happens only in certain defined places in the body. If you think about, if you look at the walls in the room that you're in, you have probably some drywall up. If you're able to just sort of remove the drywall, what you'd see is the 2x4 studs, and you'd see the wiring in the wall. And you would notice that in between the 2x4 studs, there's a lot of space around the wires. There's just maybe some soft insulation, nothing really tight. Where the wire has to pass through a 2x4 stud, there's usually a fairly small hole that's been drilled, and the bundle of wires has to sort of compact down and pass through that hole in the 2x4 stud before it can pass into the next wide open space. And this is sort of like the nerves in your body are a very good way to think about them, is that's the electrical wiring in your body. Just like the electrical wiring in your house passes through all these tight spaces at certain locations, so do the nerves in your body. These tight spaces often occur around joints, and so what can happen is, when you're a young kid or when your nerves are not a problem, the nerves tend to fit appropriately in these spaces, and they're able to glide back and forth, and everything's fine. What happens to the nerves because of that first layer of the cake, whether it's the diabetes or whatever? The nerve tends to start to swell. It starts to develop fat tissue inside the nerve and surrounding the nerve. And so if you think of like, just taking your wedding band or a ring that fits on your ring finger, if you take that ring off and you slide it over your little finger, you'll see that there's a little bit of room everywhere, but the little finger fits good. Even your ring finger fits okay because you can get it on and off. If you try to take that ring and put it on your thumb, you'll immediately recognize, you can probably get it on halfway down to the first joint of the thumb, but you'll see that the tissue is kind of squeezed where it passes through the ring. And this is sort of what happens to peripheral nerves when they swell up like a balloon. If you take a balloon and thread it through a napkin ring, you start to blow it up. At first it fits just fine, but after a while, as the diameter of the balloon increases, that napkin ring starts to act as a compression point on the balloon, and that's essentially what's happening to peripheral nerves as they become swollen and infiltrated with fatty tissue. The tight space that they used to fit in doesn't increase in size to accommodate the increased volume of the nerve, and so that tight space will start acting as a compression point on the nerve. And it's actually that pressure on the nerve that produces the clinical symptoms that everybody thinks of as this medical condition called peripheral neuropathy. Probably the best known example of a peripheral nerve compression would be carpal tunnel syndrome, which is where the median.
Well, seems like an easy solution for me. All I gotta do is instruct the HDL, the LDL to remove the fat. Then it would fit through the hole easy. Should have no pain. I don't think I'll do it this next fast, but hopefully I'll be able to start it where the pain will stop getting worse. But I told you guys, I'm meditating, telling the HDL and LDL they got to work together. HDL has to remove the cholesterol. The LDL needs to carry the cholesterol back to the liver. The liver converts it to ketone. Everybody's happy. By the way, that starts in full blast probably on the third day of the fast. So the more I learn about the nervous system, the better I feel.